Assalamu alaikum. This video is regarding the nose examination or nasal examination for the medical students. These are the basic steps for any ENT examination. The upper, uh, you start any examination with greetings, introduction, taking consent, proper positioning, light focusing, and start with the examination. So, as this video is regarding the nose, so we will put emphasis on nasal examination. These are the main headings under which the examination of nose is carried out. And then at the end of the local nasal examination, we'll do the lymph node examination as well, which is part of the ENT examination. So these are the basic equipment which is needed to perform the ENT examination. This is the headlight. This is the metallic spatula or tongue depressor for patency test and for posterior rhinoscopy. This is a posterior rhinoscopy mirror. This is 30 nasal speculum for anterior rhinoscopy. Alcohol swab is for the smell test. Better if you have scented handkerchief or scented uh, cloth. Then this is the lighter to heat the mirror, and this is Jobson horn probe. This is not indicated in every examination, but if we have to differentiate the inferior turbinate from any nasal mass, we do probe test. We pass the probe around that mass. If probe passed all around the mass, then that mass is external mass. But if the probe is not passed laterally, then it will be the inferior turbinate, because inferior turbinate is arising from the lateral wall.
Assalamu alaikum. So we were going to perform the nasal examination on the patient. So for ENT examinations, there are first three basic steps in each examination, which are: number one is the introduction, then you have to take consent and positioning. Position is also very important. So number one is the introduction. अस्सलाम वालेकुम, मेरा नाम डॉक्टर मुमताज़ है। मैं नाक कान गले का स्पेशलिस्ट हूँ। मैं आपके आज नाक का मायना करना है, क्या मुझे इजाज़त है? जी। So this is the introduction. Now come the introduction and consent. We have taken both. Now the third part is the position. So the patients and the doctor level should be at the same. And for the same gender, we can sit like this, or with opposite gender, we have to be on one side. Our legs should be on one side and the patient's legs should be on the other side. Okay, so as we are of the same gender, so we can sit like this as well. So after that, the first step is the inspection. After inspection, let's do step by step. So for inspection, we have to start from the paranasal sinus area, because nose and paranasal sinuses, they are both included. So starting from the left frontal sinus going towards the right, then nasion, nasal bridge, tip, left maxillary area and the right maxillary area. Then we ask the patient for to observe for any nasal deformity externally. We ask the patient to look on the one side. So आप इस side पे देखिएगा. So laterally we see, is there any depression or hump? इस side पे आप देखें. So same from the other side. ठीक है, सामने देख लें. Now to look for the vestibular region, we have to touch the patient, but this also comes under inspection. So we lift the tip of the nose to see the vestibular region. So this concludes the inspection. After inspection comes the palpation, and we will palpate all these areas which we have inspected. So putting the hands at the angle of mandible, we first palpate the left frontal area, then right, not simultaneously but separately. Okay, then the floor of frontal sinus, nasal bridge, because this all is also the area of the ethmoid sinus, dorsum of the nose, then maxillary sinus area. So we can see the facial grimacing, or even ask the patient if the patient feels any tenderness in these areas. So after the palpation, now we come to the third step, which is the patency test. So we take a metallic spatula or a tongue depressor, and we will ask the patient to breathe normally, and we put it underneath the nostrils. आपने आराम से सांस लेना है, ठीक है? So the fog is on the both sides. आराम से सांस लेना है, जोर नहीं लगाना. So the patient respires normally. We don't have to ask the patient to forcefully breathe. After this, we will do the smell test. अच्छा, अभी आपने अपनी आंखें बंद करनी होंगी. मैं आपको कोई चीज सूंघाऊंगा. आपने मुझे बताना होगा कि वो उसकी आपको स्मेल आ रही है या नहीं आ रही. ठीक है, आंखें आप बंद कर लें और खोलनी नहीं जब तक मैं ना कहूं. ठीक है. सो वी टेक द स्पिरिट स्वैप. We close one nostril and ask the patient, कोई आ रही है खुशबू बदबू?
जी खुशबू आ रही है.
Now we close the other one and ask the patient the same question. कोई स्मेल आ रही है अभी?
जी.
अच्छा, दोनों साइड पे एक जैसी है कि नहीं?
जी.
ठीक है. So but this spirit swab is not the best material to check the smell test. The best thing is either use a scented handkerchief or a tissue. So I have this ether with me. So close the eye. आपने आंखें बंद रखनी है. And now we will do the same. So this is more pleasant rather than the pungent smell of the spirit. कोई स्मेल आ रही है आपको?
जी.
अभी बताएं.
जी.
दोनों में एक जैसी है या किसी में ज्यादा थी?
दोनों में एक जैसी है.
ठीक है, आंखें खोल लें. Now we will perform the anterior rhinoscopy. So this is the thirticum speculum. We place the thirticum speculum on the table with prongs facing upwards. Put our index finger and hold with the thumb and take our middle finger around. Now we have to insert it like a triangle and we have to visualize from this area. So we will insert it like this and see the septum, the medial wall, the lateral wall, roof and floor, and close it, not completely, so the hair vibrisses not come. But when we are inserting it, it should be properly fully closed like this and visualize like this all. And now we take it up. Now we will perform the posterior rhinoscopy. For posterior rhinoscopy, we need a step-up mirror and a tongue blade. We will heat the mirror side so the fog from the breath should not obscure our view. But we have to explain the whole procedure to the patient. अच्छा, अभी मैं इस शीशे से आपके नाक के पिछले हिस्से का मायना करूंगा. ठीक है, इस शीशे को मैं थोड़ा सा गर्म करूंगा ताकि इसमें भाप ना जमे, लेकिन वो मैं आपको चेक करा दूंगा, ज्यादा गर्म नहीं होगा. ठीक है. सो वी विल हीट द मिरर साइड and check on our side first. If we feel it's okay, then ये देखिए ज्यादा गर्म नहीं है. ठीक है. The mirror should be held in our right hand while the tongue depressor should be in our left hand. मुंह खोलें. शाबाश. जुबान अंदर रखनी है. आराम से. शाबाश. आहा बोलें.
आहा
आहा.
आहा आहा.
चल. Okay, good. So this way we have examined the nasopharynx. The other methods to examine the nasopharynx is via the rigid nasoendoscope or the flexible nasopharyngoscope. Now the last step for our examination is the lymph node palpation. So to do that, we have to go on the back side of the patient to perform the lymph node examination. To check the lymph nodes palpation, for the lymph node palpation, it shouldn't be done on both sides simultaneously. One side should be done at one time. Why? Because we have to flex the neck to one side. So we will do, there are two basic groups, superficial and the deep group. Superficial groups we can do it simultaneously, like the first is the preauricular, postauricular, occipital, this parotid. Okay, but now the main is the deep lobes. So गर्दन आप थोड़ी सा झुका लें और इधर कर लें. Now with the pulp of our fingers, this is submental, we roll it, and this submandibular. So these are level 1. Submental and submandibular is level 1. Then at the angle of jaw, which is level 2 or upper cervical. Then along the sternocleidomastoid, in the middle part is the mid cervical or level 3. This is the lower cervical, level 4. This is level 5. This is level 5 in the posterior triangle. Now, on the opposite side, इस side पे सर ज़रा झुका लें. We perform the same submental, submandibular, upper jugular, mid jugular, lower jugular, posterior. अच्छा, कंधे ऊपर करें. Shrug the shoulder and check the supraclavicular. This supraclavicular also come in level 5. The level 6 is the tracheal or pretracheal. These lymph nodes are usually not enlarged and we usually don't palpate them. And level 7 is the